So a Mediterranean diet is one of the best studied diets in helping with heart health. At its core, it's about extra virgin olive oil, nuts, vegetables, fruit, pulses, and whole grain food, and trying to avoid red meat and ultra processed foods, modern foods that we buy in the supermarket. And the way it works is quite elegant in that it reduces inflammation and it helps with your cholesterol profile, boosting the good cholesterols and getting rid of the bad cholesterols. It also has a beneficial effect on your blood pressure and helps keep your heart blood vessels supple. What we've found is that calorie counting itself doesn't really work, and that having a restrictive diet that you go on for a short period of time also doesn't work. In fact, I don't tell people to go on a diet in the same way that they might go on a holiday. It doesn't make sense. Your diet is something that should be for the long term because you're aiming to have a good, healthy life for the rest of your life into retirement. And therefore, what you need to do is change what you're eating every day so that it's baked in to everyday life and not a diet. And that then is changing the culture back to the traditional style of diet, which for most of us was more Mediterranean in style and less of the ultra processed foods. There's a feeling that that should be more expensive, but I don't think it is. The tins of beans and the bag of lentils are not expensive. They don't go off. They sit in your cupboard. It's easy to take them out and add them to your meals. And when we talk about a traditional diet, for us, that's generally a Mediterranean style, but for other traditions, it doesn't have to be that you adopt a European style. So if you've got an African diet or an Asian diet, then we're not expecting you to suddenly become Mediterranean. It's going back to traditional ways of eating that's important. So my feeling would be that the general theme should be that we move to traditional forms of diet. And for most of us, that's a Mediterranean style way of eating. So fats had a bit of a confusing time. In the past, we were told that fats were generally bad for us, and our dietary guidelines aim to reduce that. The new American guidelines on diet haven't really helped and still promote some unhealthy types of fat. In general, the fats that we want to still be eating are the ones that are unsaturated. And those are olive oil, avocados, nuts, oily fish, mackerel, for instance. And what they do is they support the good cholesterol and have anti-inflammatory effects and will downplay the bad cholesterol. The fats to avoid are the unsaturated fats, and these are the ones that you get in pastries or in red meat or butter, for instance. And what they do is they actually increase the bad cholesterols and they're pro-inflammatory. So fat isn't really the villain that we were taught in the past. And some of the food guides that suggested that we lower fat meant the industry promoted low-fat foods. But to do that and to make food taste good, they added sugar or they made it processed. And we ended up with food that was actually worse for us. Interestingly, you don't really get a lot of your cholesterol from your diet. So switching from from saturated fat to unsaturated fat will make a bigger impact into your cholesterol than just honing in on what foods might actually contain cholesterol itself. What we found is that eating fats and protein actually slows down digestion. It makes you feel fuller for longer and makes you feel as though you've had a decent meal. That's particularly important for our breakfasts, which in the modern day in Britain tend to be a bit of a sugar rush with just carbohydrates, toast and jam, or simple cereals. And in fact, we probably need to go back to adding in the egg or maybe the mackerel, although I wouldn't add in bacon and sausage. With regards to nuts, I think these have been demonized too, because if you look in the back of a packet, you see a lot of fat and it might get a red label on it because of that. In actual fact, when you have nuts as a snack, you don't absorb a lot of those fats. And if you were to reach for a handful of nuts as a snack during the day, then you'd be much more satisfied and healthier than to reach for a bag of crisps or sweets. And it will keep you going until your meal. So my message is that I wouldn't fear fats and oils as such. They make your dinner tasty, but you need to be looking at the right kind of oils. Uh, and going for a low fat option doesn't necessarily mean it's healthier. So for many years we thought that red wine had some magic anti inflammatory process that helped with the heart. And that might explain why the French seemed to live longer despite having quite rich diets. It sounded a good story, but it was probably sold by the wine industry. In actual fact, there isn't really any benefit. And the confounding factors are that people who drink red wine tend to have other factors in their life that make them live longer. They may have a better social or economic profile, or they do more exercise. So actually, there's no amount of alcohol of any kind, even red wine, that is beneficial for our health or even for our heart. If you want the added protective features of red wine, the polyphenols and the antioxidants, then you'll get that just from eating grapes or vegetables or fruits, and they don't have the downsides. With regards to the heart health, what we found is that alcohol unfortunately raises your blood pressure. It makes you more prone to regular heartbeats, and if you have enough alcohol, you can actually cause heart failure. Any amount of alcohol, unfortunately, seems to increase your risk of cancer. And when I talk to patients who want to lose weight, then one way of doing that seems a no-brainer is to cut back on alcohol or stop it entirely. Alcohol is quite ingrained into our society and our culture, but I think that is changing, and I see quite a lot of young people now choosing not to drink. In my opinion, industry is yet to come up with a red wine that tastes good and has no alcohol in it. But there does seem to be plenty of low alcohol beers that taste well, and pubs often now have that on tap. There's some low alcohol spirits and cocktails, in fact, and they may have some of the relaxing effects that a glass of red wine at night in good company can give you. So by all means, enjoy a glass of red wine if you enjoy the taste, or if you're in good company, relaxing with friends and for a special occasion. But don't take that glass of wine because you think it's doing yourself any good health benefits. And if you choose to celebrate without having any alcohol, then you're not missing out. So fibre is one of those unglamorous topics in health, but actually quite a powerful one and certainly low cost. Most of the cholesterol that is in our body isn't actually from our diet, but produced by the liver. And your body recycles that fat, and therefore you can actually lower your cholesterol by changing your diet, but not the way you think. There are two types of fibre. One is a soluble fibre, and that's a fibre that you'll get from oats or from apples or bananas or lentils. And that's a soluble gel-like fibre. And when your liver releases cholesterol, those fibres absorb that cholesterol and help get rid of it. And that's the way it will lower your cholesterol. The other kind of fibre is the insoluble fibre that you get on the skins of fruit and vegetables or in whole grain meals. And while they don't directly affect your cholesterol, they do help improve your gut health and they make you feel fuller, which has longer benefits for your heart in general. We know that fibre is good for your gut bacteria, and we know that that's good for lowering inflammation in the body and improving your artery health. Most adults in the UK aren't eating nearly enough fibre, and the latest guidelines are still probably an underestimate in what we need to eat. But some people have problems taking fibre in a diet. That might be because they just suddenly increase the amount because they go on a diet. And what you need to do is just gradually increase the amount of fibre over a long period of time, drinking plenty of fluids. And your body and your gut eventually get used to that increased diet and will tolerate it. There's plenty of simple ways of increasing the amount of fibre in your diet. Just swapping from white rice or white bread or pasta to whole grain versions will work, but also adding a tin of beans or lentils to your meal. Keeping the skin on your fruit and vegetables will help, or switching to porridge for breakfast. Personally, I've enjoyed exploring red rice and even black rice, And while it takes longer to cook, it certainly does provide quite a dramatic meal when you present it. So overall, I regard fibre as a pretty low cost intervention, and I've yet to meet a patient who would benefit from having more fibre in their diet. So for a long time, coffee had a bit of a bad reputation because it increases your heart rate and temporarily can increase your blood pressure. So that doesn't sound good. And historically, we've generally asked patients how much coffee or tea they drink. And if they have heart problems such as rhythm problems or palpitations, we've generally encouraged them to reduce their coffee intake or even go without. But good quality studies looking at people who drink coffee regularly, and by that I mean 3 or 4 cups of ideally good quality coffee, have shown quite a different picture. And it seems as though coffee and caffeine may actually lower your risk of heart failure, of stroke, and of diabetes. And that's to the extent that the American Heart Association has just published a big scientific statement all about coffee and caffeine, effectively saying that by and large, it's good for your health and for your heart. Last year, there was a fascinating study with a wonderful title, the DCAF study. This looked at patients who had atrial fibrillation that then got treated back to normal heart rhythm. And they randomised some patients to carry on drinking at least a coffee a day. And for other patients, they told them to avoid coffee altogether. What they found was that patients who carried on drinking coffee had far less recurrence of their atrial fibrillation than those that abstained. So I love it when a good quality trial proves that received wisdom was wrong. What you might also be surprised is that coffee also contains that wonderful soluble fibre we're after and seems to be good for our gut. But your response to caffeine is quite personal. And some people can get quite jittery if they drink too much coffee. And if they have it late in the day, it can affect their sleep. And we know that sleep's very important. So if it does affect you that way, then I wouldn't be encouraging you to drink more coffee, particularly later in the day. The health benefits do seem to be largely related to black coffee, I'm afraid. And if you add cream or sugar, then you are going to downplay the benefit. We also don't know whether the benefit also goes on to drinking tea, probably. It certainly doesn't go on to drinking Coke, I'm afraid. So for the vast majority of us, having that morning coffee is a good way of keeping our hearts healthy.